Good afternoon, everyone, and thank you for joining the Emory University COVID-19 Vaccine Town Hall. My name is Anita Pay, and I will provide a few instructions before we begin. Attendees will be placed on mute throughout the call. The Q&A feature is active, and you will be able to submit your questions using this feature throughout the session today. Questions submitted today will be addressed in future communications. You can also email your questions to campusresponse@emory.edu. Again, that is campusresponse@emory.edu. At this time, I will turn the meeting over to President Perez.
All right, well, thank you, Anita, and welcome to everybody. I want to thank you for attending. This week marks one of the most hopeful milestones in our nation's battle with COVID. And it really is truly a remarkable day when, for the first time, Emory Healthcare will be inoculating healthcare workers against COVID-19. Now, we've gotten to this moment after an incredible year in this global pandemic, but it's truly been a collective effort unlike anything in modern American history. And Emory University has contributed at every level and every step of the way. And I couldn't be prouder as president of the university to be with you here today at this milestone. I want to begin by thanking all of the Emory healthcare workers, the doctors, the nurses, the technical staff, the frontline staff. You have been the heroes in this fight since the pandemic hit in Atlanta earlier this year. And I want to thank the Emory researchers, our scientists, our postdocs, our research staff, who've called upon their work in basic science of over decades of basic science research, the translational research you've done to help develop a vaccine in record time. It truly is an amazing story with the virus, this novel coronavirus being identified just about a year ago, sequenced in China, and today people will be getting inoculations against it at Emory Healthcare. Thank you for your hard work that has brought us to this point. And we want to talk about the next steps in regards to the vaccine against COVID-19. Today's speakers will share information about the vaccine, how it works, what you can expect, how it will influence our choices and decisions going forward at Emory University, how we build trust about the safety and the efficacy of these vaccines. Dr. Jonathan Lewin, the Executive Vice President for Health Affairs and CEO of Emory Healthcare, has been briefing the Emory Healthcare community regularly about the progress towards the vaccine, the research that's taking place, and how Emory Healthcare has responded. And we wanted to broaden that discussion to the entire Emory University community today. So thank you for joining us. And so with that brief introduction, I'd like to welcome Dr. Lewin, have us join this conversation and lead us in the discussion this morning.
Great, thank you, Greg, for your thoughtful words. We are indeed indebted to our care teams, our researchers, our volunteers, and the countless other essential workers who are making our healthcare and university systems hum. As President Fenves noted, education and consistent communication are key for our community. And today's town hall is the first of many communication initiatives as we move into this new phase of the pandemic. It's almost cliche at this point, but we are navigating through some unprecedented times and challenges. At this early stage, we're uncertain about vaccine availability, both in the short and the long term, but we wanted to inform the Emory community about what we do know about the safety and efficacy of these vaccines and to begin to answer some of your questions. The remarkable speed with which we now have a COVID vaccine available in our arsenal of weapons reflects the international cooperation, unyielding perseverance, and sheer intellect of the individuals who set out to solve this problem. This too has been unprecedented and is largely why we're able to convene today to better understand how this vaccine works, how it can be an effective tool in our efforts to fight COVID, but more importantly, why we think each of us should receive it. Here are the faculty members from whom you'll be hearing today. So without further delay, I'd like to welcome Dr. Mary Beth Sexton, Assistant Professor at the Emory School of Medicine. Mary Beth has been an instrumental member of our team of epidemiologists, working tirelessly with many others to lead Emory Healthcare's COVID response. Mary Beth?
Thanks, Dr. Lewin, and hi, everybody. Good morning. We'll talk just a little bit about what is out there with respect to the vaccines that are available. And the ones that are right now either have been granted an EUA or are in the process of being granted that EUA, that emergency use authorization from the FDA, are one from Pfizer. That's the one that injections are starting this week in healthcare workers, and then one from Moderna that is close to being granted that EUA. And we'll talk a little bit about how those vaccines work, because that is something new for a lot of people. There are additional vaccines still in the research pipeline that are very promising, from AstraZeneca, from Johnson & Johnson, from Novavax, and from Sanofi. And those all involve slightly different ways of getting the immune system to recognize COVID-19 to how the mRNA vaccine works. Some of those actually still have ongoing trials in the United States. And so if you're interested in participating in a vaccine trial, you can volunteer at that website that's provided on the slide. The way that the mRNA vaccines like Pfizer and Moderna work is that if you've seen these pictures of the COVID-19 virus, you'll see those little spikes or protrusions coming off the surface of it. Those are called spike proteins. And the vaccine actually contains a temporary genetic instruction, that's the messenger RNA, for how to make one of those spike proteins. And so your cells use the instructions, they make a few copies of that spike protein. Your immune system recognizes that as something that's not supposed to be there and clears it out of your body. But in the process, it makes antibodies to it. So that if you actually get exposed to a coronavirus particle in full in the future, your immune system will know that it's not supposed to be there and will also react. So all of these vaccines, the ones that we're now administering and the ones that are close, are a really important first step toward ending the COVID-19 pandemic. And the great news is that all of the initial studies show both that they work very well and that they seem to be very safe. As we mentioned, the Pfizer EUA was granted last week, and vaccine administration has started this week, including today at Emory Healthcare. And then we anticipate the Moderna maybe as early as later this week, also with an EUA. We're still not sure how much vaccine Georgia is going to receive, how much Emory will receive. And so we continue to partner with the Georgia Department of Public Health about how that is going to roll out. What's going to be most important is that people are willing to get these vaccines as they become available to the general public. And that's because it probably will take at least 60% of the United States getting the vaccine to start to establish herd immunity, where we really can prevent further spread of COVID and start to get life back to normal. And so that's what we're really going to try to do here today, is to talk about what we know about how the vaccine works, why we think it's safe, why we think people should be willing to get it when it becomes available, so that we can continue to communicate that out there so that people are willing to get this and that we really can stop COVID spread. And then Dr. Mehta is now going to talk about how this vaccine development has happened along those lines of how we know this is safe.
Thank you so much, Dr. Sexton. And again, thank you for all the hard work you have been doing with your team to prepare our healthcare system for COVID and prepare for these vaccines. One of the questions that we often get is, how were these vaccines developed so quickly? And we have definitely seen an unprecedented timeline from discovering this virus to now having vaccines going to people to protect them. But it really is built on great science that's been going on for decades using mRNA technology. This is a new vaccine technology, but it's built off of years and years of data and science. We have had this technology in other clinical trials, so we have a good understanding of how they work and how to improve the technology to what we have now. And fortunately, our colleagues in China were able to produce the sequence of the virus very quickly so that vaccine researchers in early January 2020 ready and started working on creating these new vaccines. So it's really a great head start that our colleagues in China gave us. And because the vaccine just involves mRNA genetic instructions, researchers don't have to wait to grow the virus or modify the virus itself, which can be difficult and time consuming. And that has all helped us get from virus to vaccine in just under a year. We also get a lot of questions about the vaccine safety and its side effects. The vaccines look to be very safe based off the clinical trials data that we have both from Pfizer and Moderna is being reviewed as we speak by the FDA right now. The side effects have been reported, but there are really two important messages that we all need to remember. The side effects may look like COVID-19 symptoms, but that does not mean you have COVID-19. Again, none of the vaccines have the virus in it. It's only that temporary message. And it also means your immune system is reacting, and that's a good thing. That's what we need, that really good immune response. The studies have also noted that some people have some severe reaction. And severe in research term is a little bit different than what we think about it as clinicians. It means the reaction may have disrupted temporarily some daily activities. It does not necessarily mean they were dangerous, life-threatening, or that they went on for any extended period of time. And it's also important to note of these type of reactions, less than 10% in both the vaccine trials, the Moderna and Pfizer, experienced these type of side effects. So up on the screen now is a graphic provided by the CDC on the initial rollout of these vaccines in the United States. And as you can see, we have in phase 1, phase 1A, phase 1B, and phase 1C. Phase 1A will include healthcare personnel and also residents of long-term care facilities. Once we get through this, then we'll move to phase 1B, which will be essential workers. And this will be defined by our public health officials, but you can see some examples here on the screen. And then we'll move on to phase 1C, which will be adults with high-risk medical conditions and adults over the age of 65. We will hopefully very quickly move through this. And as we get now one approved vaccine, hopefully another one that is authorized soon, and potentially more down the road, we'll be able to move through this ladder very quickly. So many have asked, why are healthcare workers being prioritized? And that's really for a couple of reasons. It's really important to note the reason is not because we're worried about healthcare workers getting COVID-19 from our patients. We have data here at Emory, as well as colleagues throughout the country, that shows that our PPE, our protocols, and our infection prevention are working very well to prevent transmission from patient to healthcare worker and vice versa. But really what we're doing is trying to preserve our healthcare delivery to keep patients safe. If we can get healthcare workers across the country vaccinated, it means that as we are seeing surges of COVID-19 cases, we'll have enough staff to safely take care of those patients and get them back to their families. It is also critical that we take care of our patients with both COVID as well as those with other life-threatening conditions. We need to be able to take care of all of our sick people. And we need to prevent transmission to vulnerable patients. And this is particularly important in our long-term care facilities. And now I'll turn it over to Dr. Lewin again, who will talk more about our timelines.
Great, thank you, Anish. And very excited to say that Emory Healthcare received its first vaccine allocation first thing this morning. Something we've been waiting for. We've been watching, as I'm sure you have, TV images of people around the country. And we're glad to finally be in that group, in that select group. What's important to know is that the initial allocation to the state of Georgia and then their allocation to us is going to be limited. So we're going to still need to prioritize even amongst the Emory healthcare and faculty healthcare workers and clinical providers. We need to follow the state and federal guidelines, which are pretty prescriptive about who we can give vaccine to when. So right now, again, it's that phase 1A, healthcare workers, long-term care facility folks, and those are the only people that we're allowed to vaccinate. We don't really know at this time just how much vaccine we're going to receive and when we're going to receive it. And we anticipate that vaccines will be in short supply, again, even for these priority groups for right now. If I could have the next slide, please. So there's a lot of logistics in actually getting the supply. The first step was an application for vaccine allocation to the Georgia Department of Public Health. Again, they warned us, and we know the initial vaccine delivery is going to be limited. And then vaccine storage is really challenging. As you may have seen also, it takes, we have minus 80 degrees centigrade, that's minus actually 112 degree Fahrenheit freezers, which we have now on site. As we received the vaccine this morning, we first inspected for quality. We make sure we're prepared to administer it, that we have everything else we need for administration. And the work, our work on location and scheduling for administration of the first dose has already happened. And I'm excited to say that our first healthcare worker will be getting injected at 1 o'clock, right near the end of this vaccine town hall. One of the things that's important is we've created the careful information technology programs to track who we give the dose to, because we have to give the second dose at the right time, again, about 21 days for the Pfizer vaccine, 28 days for the Moderna vaccine. Information for our employees about vaccines in terms of safety, administration, planning, everything else is underway and has been rolled out for the Emory healthcare folks, and will be rolled out as well for the Emory University group as we get closer to their vaccine administration. And we're going to continue to outreach to employees, to faculty, including more town halls. At Emory Healthcare, we actually have town halls we're doing coming up this week in Spanish to make sure that all of our employees can understand and can learn. And we're looking forward to doing that as well as we move forward on the university side. So I'd now like to ask Dr. Orenstein to take over and tell us a little bit about optimization by vaccines.
Thank you very much, John. Vaccines don't save lives. Vaccinations save lives. A vaccine dose that remains in the vial is 0% effective regardless of the results of the clinical trial. Thus, our goal is to optimize getting vaccines to people for whom they are recommended, getting acceptance, and then vaccination. Vaccines protect in several ways. One, it protects the individual and protects the vaccines available, a very high proportion of those people from getting COVID disease. This also helps us in decreasing stress on our healthcare facilities, including hospitalizations, ICUs, and outpatient clinics. And also, it is likely, although we don't know for sure, that vaccines will substantially decrease transmission, and we'll have to find that out, but the vast majority of vaccines do that. And what does that mean? It means that when you get vaccinated, you're not only helping to protect yourself, you're helping to protect the community. And that's known as herd immunity. And what it means is if you're a transmitting case, but you only come into contact with immune individuals, you're not going to transmit, and that chain of transmission will be broken, and you indirectly protect the community. So first of all, we need to get vaccination out. We need to minimize barriers to access. These include financial barriers, making it free, and providing it in locations and at hours that are convenient for people to get it. Second is to provide information on vaccine safety and efficacy that is based on the best available science, and to transmit this information through trusted sources. Another issue is monitoring the uptake and identifying populations that are hesitant. And when we find hesitant populations, to determine how best to address their concerns. I think it's valid that people have questions, and we need to be able to address those if they do have those questions. Another issue is we need to continue to monitor vaccine effectiveness. One of the questions we don't know about at this point is how long immunity will last, because the clinical trials were only several months so far. We need to determine whether we need boosters or not. Hopefully we don't, or hopefully there will be at long intervals, but we need to determine that. And then we need to determine if there are subpopulations for whom the vaccine might be less effective, for whom we might want to give extra doses. Another issue is the need to continue monitor safety to detect potential rare events and potential subpopulations at risk for those events that could be made contraindications to vaccination. The other issue is the one I started off with, is will this vaccine or these vaccines impact on transmission? We think there will, but we'll have to look at that, and that is one of the things we'll be watching as we roll out the vaccines. I'd like to now turn it back to Dr. Lewin to deal with the question and answer session.
Great. Thank you very much, Walter. That was great. So I'd like to thank everyone for the many questions we received. We literally received over 100, actually I think 175 before by email, and we've had quite a good number here that are still rolling in. What we'll try to do is to answer as many of these as we can today, but clearly I won't be able to answer all of them. But while we can't answer all of your questions in this presentation, we'll review them, we'll post a Q&A on Emory Forward site in the coming days so that all of the questions that you ask can ultimately be answered. So what I'd like to do then is to introduce Dr. Sharon Rabinovitz, who is going to take us through the questions and answers. Dr. Rabinovitz is the Executive Director of Student Health Services. And having worked with Sharon for a number of years, I can also say that Sharon is deeply committed to the health and well-being of our students and is an incredibly valued member of the Emory community. So Sharon, I'll hand it off to you then to be asking some of those questions to our expert panelists. Thank you.
Thank you, Dr. Lewin, and thank you for those kind words. And good afternoon, everyone. We want to thank you for your tremendous engagement in this historic public health response by submitting your questions in the chat today and for submitting them prior to this town hall. We are actively reviewing each and every question, and several have risen to the top, which we will address today with our panel of experts. As we have stated previously, this is just the beginning of this important dialogue and communication effort. The first question relates to the logistics of the vaccine distribution. This question is for Dr. Lewin. With the understanding that Emory Healthcare is receiving its initial vaccines today, how will Emory University prioritize who will receive vaccines?
Great, well, thank you. That's a great question. I'll give you a little bit about how Emory Healthcare did it, because I think it relates. So Emory Healthcare launched a multidisciplinary team who worked, including ethicists, epidemiologists, clinical folks, to intentionally and equitably prioritize who received the vaccine and in what order. And I see the university doing the same thing. The team has to follow the advisory committee for inoculation or practices from the CDC, as well as other CDC guidelines that are created for distribution of the vaccine. So when each group is vaccinated is predetermined by these governmental areas, but within a group like essential workers on campus or people with vulnerabilities, those are all going to be determined again by a multidisciplinary group here on the university campus.
Thank you, Dr. Lewin. The next question is for Dr. Sexton. The vaccine is 2 doses. Do I have to take both?
So for right now, we are absolutely recommending that everyone get both doses. And the reason for that is that that's what all of the studies looked at. So that's what we know works. When we say these vaccines are at least 95% effective on average, that's in people who got 2 doses. And so if you're going to get the first dose, you should certainly plan on getting the second.
Thank you. I'm going to take the next question. How will the vaccine distribution impact plans and processes for the spring semester? It will not impact the plans for spring. We will continue with the current mitigation strategies and on-campus density plans for the foreseeable future. Our baseline operations will stay consistent and intentional as we allow the vaccine to be disseminated throughout the spring semester. I'll take the next one too. Will the vaccine be mandatory? This is also going to be a very intentional decision. Before taking such a step, we would establish a formal process for collecting staff and provider feedback, as well as an ethics review before mandating any vaccine, especially before FDA approval, in addition to the EUA. The next question is back to Dr. Sexton. If I am vaccinated, can I stop wearing the mask?
So for right now, unfortunately, because I know we're all getting tired of this, absolutely not. We are going to continue to wear masks and practice social distancing and good hand washing for the foreseeable future. And there's a couple reasons for that. First of all, 95% efficacy for a vaccine is incredible, but it still means there's 5 out of every 100 people who, for whatever reason, may not mount an immune response. And so not everybody is going to be protected. It takes a little while after you get the vaccine to be protected. Because these are new vaccines and they're having to ramp up production, we're not going to have supply to vaccinate everyone in the world right away. And then finally, we don't know for sure yet if you get exposed after you've been vaccinated, whether you might carry the virus in your nose and in your throat without having symptoms yourself and still be able to infect somebody else. That's a question that's going to have to be answered with ongoing research. So until we can vaccinate enough people to really have good control of this, everybody's going to need to mask from now on. It'll be the same advice we've given people who've had COVID infection in the past to continue masking for right now.
Thank you. That's another very important message. The next question is for Dr. Ornstein. How long will the vaccine be effective for?
That's a very important question and one we don't at the moment have an answer for, and we're going to have to continue to look. What we do know is it worked for around 2 months, very, very high protection levels, but we will just have to see. But again, not getting the vaccine is 0% effective and really problematic, but we will be doing that and determining when boosters will be necessary, if they are necessary at all.
Thank you. The next question is for Dr. Lewin. Will Emory provide COVID-19 vaccines to students, staff, and faculty, just as it does for flu vaccines?
So the short answer is yes. We definitely plan to. The details are still being worked out and will be provided as we know more, again, as we get further CDC guidance and otherwise. But the answer is yes.
Thank you. The next 2 questions are for Dr. Maida. How safe is the vaccine if you have a food and allergy to medication?
This is also an excellent question. As far as we know, that there are not any specific allergies to these vaccines, though there have been some allergic reactions. So what I encourage everyone to do who's getting the vaccine is look through the vaccine information sheet that you will get, and it will have the ingredients on there. If you have any allergies to those ingredients, then just let your healthcare provider know that you're allergic. There are potentially some differences in the ingredients of the currently authorized one in the Pfizer vaccine, and one that we hope to have authorization soon in the Moderna vaccine, and then the other ones that will hopefully be coming down the road. So it's always good to review that sheet and discuss it with your healthcare provider.
Thank you. This next question has several questions within the full question. So I'll break it down. Do the flu vaccine and the COVID-19 vaccine have conflicts or any interaction with each other?
So that's an excellent question. And let me first start out by saying, please get your flu vaccine if you have not gotten it. If you still have a lot of opportunity to do it, so please do it at your earliest convenience. Right now, we don't have data on the flu vaccine and the COVID vaccine about getting them at the same time. So the current soft recommendation is to space them out by approximately 2 weeks. But as we have learned with other vaccines, most of our vaccines can be administered together without any problems. And we don't anticipate any interactions between the flu vaccine and the COVID vaccine. But right now, the soft recommendation is to space them by 2 weeks.
So I think you answered the second part with an emphasis on get your flu vaccine now if you have not. The next question is for Dr. Orenstein. Can someone who is vaccinated still spread COVID-19 to others? I think this is a reiteration of what Dr. Sexton said, but I think an important point.
I think this again is a very important thing in that we don't know at this stage. We are hopeful. As I said, almost all other vaccines, the vast majority, do not decrease transmission as well. We just don't know it with this vaccine, and we'll be studying it to determine that.
Thank you. The next question is also for you, Dr. Orenstein. Is it true that the vaccine does not spread infection, only severe illness from the virus?
That is not true. The disease, certainly the data are great that the two vaccines we've been talking about do a wonderful job at preventing severe illness. They also prevent illness itself. It's not clear at this stage how well they do with regard to asymptomatic infections and asymptomatic potential transmission to others. And those are the things that we'll be looking at over time. But in terms of you're getting sick, it marked effectiveness, and particularly getting severe illness is marked effectiveness.
Thank you. The next two questions for Dr. Sexton. If someone has already had COVID-19, is the vaccine needed?
So right now, we are recommending that people who've had COVID-19 get vaccinated. And there's a couple of reasons for that. One is that we don't know yet if everybody who's had COVID-19 is immune, even for a short time period. And we don't know how long that immunity lasts. And so we're going to recommend that people get vaccinated to make sure that they are still protected. The one caveat to that is that the guidance as a soft recommendation has suggested that people not get vaccinated in the first 90 days after they've had COVID. And that's not because they think that's dangerous. That's because they do think that most people seem to be protected for at least 90 days. Reinfections within that first 3 months are really rare. And so while vaccine is in short supply, they're recommending to target it to people who probably don't have any protection. But once you're beyond that 90-day period, we're recommending that everybody get this.
Thank you. The next question is, can I take the vaccine if I'm pregnant and or breastfeeding?
And so these are questions that we're continuing to get more information about. So pregnant women, women who were trying to get pregnant, and women who were breastfeeding were not included in the clinical trials. However, what researchers have said and what a lot of the professional medical societies that take care of pregnant and breastfeeding women have said is that with a messenger RNA vaccine, there's not a theoretical safety risk specific to pregnant or breastfeeding women that they can think of. In fact, breastfeeding women are recommended to get some live attenuated virus vaccines. And we also know that pregnant women may be higher risk for complications of COVID. if they get sick. And so weighing those risks of severe COVID infection in pregnancy against the fact that there's not a theoretical risk specific to pregnant women from the vaccine, they're saying that certainly women who are pregnant and breastfeeding can go ahead and get this, and to just discuss with your doctor if you've got any particular questions specific to you or your medical history. The one thing that they have emphasized is that women who are pregnant should ideally not have fevers. And so they're recommended to take Tylenol if they get a fever while pregnant. And we do know that a small percentage of people get a fever after the vaccine as a vaccine response or side effect. And so they would be recommended to take Tylenol in that situation as well.
The next question is for Dr. Ornstein. Is the vaccine recommended to a child under 1 year old?
At this stage, no. The focus in the vaccine development has been on adults. They are moving into studies in children. We've got it down to older adolescents, 16 and above. There are studies going on in children as young as 12, but I hope eventually we will have it, but not at this stage.
Thank you. I'm going to throw out this last question to the panelists. We've seen a lot of questions about the long-term safety concerns of the vaccine. Would someone like to take this and review it with us?
Well, I think, one, there are systems in place to try and trace that out. The CDC and FDA have very comprehensive systems to look at this. The likelihood is very small, but we need to look and can then determine if there are risk groups for these. But we need to balance that against the risk of COVID disease. And we're talking about yesterday, over 3,000 people died and record rates of hospitalization. So we need to balance risks and benefits. The likelihood of long-term adverse effects is small, not zero, and that's why we will continue to look. But we need to look at what we know today and know about the seriousness of this problem.
Thank you. And actually, this is the last question, and an important one, and it is coming up often, is what is the cost to employees, staff, and students of this vaccine? Is it free? Dr. Lewin, I think you have addressed this. Can you reiterate this?
Yeah, absolutely. So it will be provided free as we go through this initial vaccination process during this winter and spring. It will be free. So please don't hesitate. Come get the vaccination. It's good for you. It's actually important for the whole community, for everyone to go out, get the vaccine, and be part of the solution. Good. Well, Dr. Rabinovitz, if that was the last question, I'll take us home with a few brief closing comments then. So I'd like to start off by thanking all of our expert panelists, thanking President Fenves for kicking this off, and in particular, thanking Dr. Rabinovitz for leading us through our questions. And then I'd like to thank each and every one of you for your time and attention for joining us. We hope this information will help guide your decision when you're offered the vaccine, and I certainly hope it will help you decide to take the vaccine. While this is the first, it will definitely not be the last educational effort we'll launch pertaining to the vaccine. So please stay tuned and encourage others to participate, engage, and provide feedback. And lastly, the holidays are upon us, and I wish you very happy and healthy holidays, but to keep them healthy, please remember to limit gatherings, practice social distancing, and really importantly, wear a mask or face covering and wash your hands regularly. We want you to stay safe and healthy. Happy holidays, and I look forward to seeing all of you in the new year.